Hi everyone, welcome to Belly Strong, where today we'll be talking about plantar fasciitis. And just before we talk about that, if you have any other questions on other conditions that tend to crop up during pregnancy, check out some of the other videos on our channel and consider subscribing if you like the content. So the plantar fascia is a ligament that sits in the sole of the foot. So if you think about the foot has a bit of an arch, and the plantar fascia sits right here and helps to keep the arch of the foot. With the releasing of relaxin, which is a hormone that is released during pregnancy, a lot of the ligaments in the body relax, including the plantar fascia, and the arch of the foot starts to flatten. As it flattens, that plantar fascia gets a little bit more of a stretch. It reduces the stability in the foot region, and that can lead to pain. Now, there are some things that can help, and we'll go through a few of those today. So the first two require a chair. So I will get up here, and you'll also need a tennis ball. Sometimes this can be a little bit soft, so a golf ball or a lacrosse ball also works really well. And we'll use this to massage out the arch of that foot, massage out that plantar fascia. So ball on the floor, you'll get it into the middle of that foot. Keep the foot relaxed, so try not to tense up the toes. Nice relaxed foot, apply some downward pressure, and then just roll the ball up and down the sole of that foot. You'll feel when you've hit something tender because it'll feel tender and a bit tight. You don't really want to go onto the toes or the ball of the foot or onto the heel. You want to keep in the area in between those two structures. And you can also do this with a water bottle that's been filled with water and then frozen. And that can feel really nice on the foot too. And you just roll up and down the sole of that foot for a minute or two. I wouldn't do it too much longer, at least to begin with, because you may find that you just sore from too much rolling. The second one is a glute release. Now, a lot of structures in the body are connected. So the plantar fascia feeds into the calf, feeds into the hamstring, feeds into the glute, into the lower back. And any tightness up here can influence pain or tightness further down the leg. And an easy way to stretch out the glute is our figure 4 stretch. So you bring that leg up and across the body, push the knee out or just let it fall out, sit up nice and tall, and then hinge forward. And here you should feel a glute stretch. If you lean away from the leg that you're stretching, you'll also feel a bit more of a stretch. And you can hold this for 10 to 15 seconds, maybe a little bit longer, and then come up, give it a bit of a release or just relax a bit, and then go back into that stretch. Okay, so two nice and easy ones to do sitting in a chair. The next one is a calf release, and what you can do, what you can use for that is a tennis ball or a foam roller, and I'll show you both. So tight calves can contribute to plantar fasciitis. So if you're using a foam roller, you'll want to place that calf on the foam roller, cross the other leg over to add a bit of extra pressure. Again, important to keep the foot relaxed. You don't want to tense everything up. And you can just roll up and down that calf muscle. On the inside, in the middle, on the outside of the calf, just finding those points where you feel tender or a bit tight. And sometimes it'll feel like you're rolling over something or clunking over something, and that is often just tight muscle and might be where you need to focus. If you want even more pressure, you can lift the hips up, but sometimes it's enough just to have that other leg crossed over the other. And roll it out, up and down, and then across, so both directions. Again, for about a minute or two. If you are using a ball, it can be a bit more pinpoint. You can put the ball straight on the floor, and again, cross the other leg over. And this time we find a painful point, we stay on it, and then we add a foot flick on that point. So those calf muscles are moving as we apply pressure to it with the ball. So just finding a point and then flicking that foot. If you find you can't get the space that you need with the ball directly on the floor, you can also, if you pretend this is a book or a block, you can put the ball on top of a block of sorts, and you can do it in this position. But those are just 3 things that you can do to get started if you are suffering from plantar fasciitis. As I always say, if you are really struggling and nothing is helping with the pain, I would encourage you to see a physiotherapist for an individual diagnosis and treatment plan. That's it from Belly Strong today. Check out some of the other videos in our channel and hit the notification bell, and I will see you soon on another video.